And welcome into To Your Health. You know, as you start to age, a lot of times things can happen. How many times have you visited with somebody and they say, yeah, just had a knee replacement or perhaps a shoulder replacement? Today we have with us Dr. Lee Murphy with Hughston Clinic. And Dr. Murphy, your mom and I are good friends. and she did a good job with you.
Oh, well, you're kind to say that. Thank you.
Amen. Great folks. But as I was mentioning on the opening here, a lot of our viewers are people that are getting a little bit older, and sometimes is it more or less an injury, or do these parts of our bodies wear out?
Well, we know that arthritis of hip, knee, shoulder is on the rise, and it's probably multiple factors, one of which is we're getting older as a population and being active older into older ages. And so the numbers are quite staggering in terms of the amount of joint replacements that are being done and that will need to be done, and the trajectory is a pretty steeply upward curve. So it's something that all of us are going to come in contact with, whether it's yourself or whether one of your family members. But having the chance of you having a knee that's arthritic, a hip that's arthritic, or shoulder that's arthritic is very high, actually.
And basically what happens is, years ago, it was pretty major, and you were held down for quite some time.
I'll tell you, it's really exciting to be, a patient in America in 2024, right? Because hip and knee replacement, shoulder replacement too, used to be an unbelievable ordeal. It involved being in the hospital for 5 to 6 days, blood loss, blood transfusions. It was just a big operation, to say it bluntly. But as we've gotten better, we have medicines that decrease the blood loss during the surgery. We have medicines that allow you to have a regional anesthesia so that you don't need as much anesthetic. Our techniques have gotten better, our speed has gotten better, therefore. And so, for instance, I did 2 total shoulders this morning. One of them took me 30 minutes, and the patient will eat lunch at their house.
Wow.
And so that's just a big step forward from where we were even in the 80s and 90s, and just being able to provide outpatient total joints that take only like 4 to 6 weeks to really get your feet back under you. And the providers that provide these are doing it at a very high level. So it is really a blessing to preserve the mobility of our population, because mobility is super important. People don't think about it. They worry about their blood pressure, their heart disease, but realistically, you don't worry about your mobility until you don't have it. And I'm talking about whatever joint it is, but preserving your mobility, I think, as you age is arguably as important as many of these other large health markers that we track so closely.
And you said a key thing also about the time under anesthesia. For an older person, cutting that in half would be wonderful.
That's a big worry a lot of my older patients have is can I stand up to anesthesia? And what I would say is with newer techniques, again, we use regional anesthesia. And I say we, I mean the anesthesia doctors, but they can block the extremity so it's numb for 2 days, 3 days sometimes, such that while you're asleep, you get very little inhaled anesthesia gases, and it's much safer for you. And so it really, some people who think they think that they're not a candidate for anesthesia actually may be, and because of our ability to provide anesthesia in different ways, really just in the last 10 or 15 years.
So basically, when a person has one of these surgeries, recovery time is pretty quick then too also.
It's a big operation. I'm not trying to over promise on that, but I would say that for a lot of people, I think they're too afraid, especially older folks, they're too afraid of the surgery, and at the cost of being immobile, being in the chair, not being able to see their grandkids. And so I do think it's a conversation that needs to be had with the healthcare provider like myself, and just say, what do you think my realistic risks are from the surgery? Because sometimes the benefits do outweigh the risk, even if you have a few health conditions, because your mobility, again, is that important, And so I think it's just a very individual decision for each person when it comes to these joint replacement operations.
And basically, as you're getting older, you're starting to feel like something's out of whack. At that point, can they come directly to you, or do they have to go through their general practice doctor?
Yes, sir. I mean, for the most part, being able to come straight to me is usually pretty easy. I mean, most insurances are accepted by our clinic. And when you're talking about Medicare and most of our modern healthcare products, in terms of insurance, it's usually not a difficult thing to get in to see us. Sometimes you do need to be directed to the right provider. So a lot of patients today can get frustrated. They said, I went here and I got told I really need to go there. And so one of the things I try to do is direct patients to the right subspecialists, because in our world, there's some people that the only thing they do is hip replacement and knee replacement.
Right.
And I think those guys do a great job. I tend to focus mostly on shoulder replacement within my replacement practice. And frankly, there's not a lot of people that do that. So, being that subspecialized provides great advantages for the patient. So it is important to do your research a little bit about who to call about, I have a hip problem and should I see this doctor or that doctor. But most doctors are very happy to see you, and this is right down the middle for us in terms of what we do every day.
And the key is, if something's starting to bother you, get it treated early on.
I really agree with that. As you age, when you start developing,
Start to wear out. Yeah, amen.
That's right. When you don't trust your leg, meaning you know it's going to hurt, so you don't want to take that step, and then you fall, and then you hurt something else, you can be on a spiral of immobility that can really affect your overall happiness, your wellness, your ability to exercise, your ability to see your family. So I just think attending to the little aches and pains when they come is probably, again, in America, is easy. Your insurance usually covers it. It might be as simple as a shot of steroid in the shoulder or a trip to the PT for 3 weeks. That's worth it to preserve your mobility.
Absolutely. Well, thank you so much, and
Yes, sir.
thank you so much for staying in Montgomery.
Yes, sir.
Because a lot of times people get that doctor and they're off to the bigger markets.
Yes, sir.
And we need you here.
I'm happy to be here.
Absolutely. And we'll be right back right after this.